Hello, my name is Dr. Andrew Ashley. I'm a family physician and I'm a member of the Canadian Alcohol Use Disorder Society. So as a family physician, I feel very strongly about sharing this information with you guys. I argue that alcohol use disorder is certainly much more prevalent than many of us think, both within our clinical practice, within our community, likely within our friend group or professional colleagues. Alcohol use disorder is certainly an illness that touches people from all walks of life, crosses all social classes, professions, genders, and cultural backgrounds. It is something that society accepts and often celebrates, which I think can also lead to a lot more harms and perpetuate the issue within our community. So it's helpful to understand the definition of substance use disorder, or specifically alcohol use disorder. So as per the DSM-5, alcohol use disorder is a clinically significant impairment or distress which manifests in a 12-month period of alcohol being consumed in larger amounts over longer periods of time. That was originally intended. And there's also another definition that I find quite helpful, is the concept of the 4 C's of addiction. The 4 C's being compulsive, cravings, consequences, and control. Is the individual having compulsive alcohol-seeking behaviors? Are they having cravings for alcohol? Do they continue to use alcohol in spite of the negative consequences? Have they lost control of their alcohol use and as a result are unable to cut back or stop? So just like most medical conditions, alcohol use disorder is a spectrum: mild, moderate, severe. You can imagine this as a bell curve. Certainly we all can identify the people who are on the far extreme or severe side of the bell curve experiencing alcohol use disorder. These are the people we see on the streets, intoxicated in the morning, coming into our emergency departments for help frequently. These are not the people who we struggle to identify. I argue that the people we struggle to identify in our clinical practices, and likely who may benefit the most from intervention, would be the people in the middle or to the left of the bell curve, who are maybe floating under the radar, who are the quote-unquote functional alcoholics who are holding a job, etc. These are the people it's important for us to screen in our interactions in the emergency room, in our family practices, within our social circles, because these are the people who may not realize that they are struggling. They may not realize that their drinking is harmful. And they are people who certainly can benefit from the interventions that we're able to offer.